I'm Dr. Oscar Wong, and I'm really happy and pleased to share with you our video series Research Primer, organized by ResearchLabX. So, just for your information, I'm a doctor currently based in Nottingham, UK, and I've worked with the ResearchLabX team to deliver this video series. So, we hope by watching this video series, we'll be able to simplify complex concept about medical research so you can apply it in your own practice. So I also want to give a shout out to Associate Professor Chong Chun Seng, who was really happy to support us throughout this series by giving us some advice and guidance. He has over 100 publications, and you can find those publications in Nature Bioengineering, Nature Communication, Journal of Gut, Journal of Gastroenterology, European Journal of Cancer. Me myself, you can always find my work in Lancet Gastro, Hepatology, Clinical Gastroenterology and Hepatology, or Journal of Obesity. Okay, so without further ado, let's start. So just to break down what we'll go through in this first episode, Kickstart Your Research Journey. First of all, we'll be looking at the overarching context of medical research currently. And second, we will be talking about study designs. Next, we're just going through critical appraisal of the literature. We'll also be going through searching for studies and basics of literature review. And lastly, we'll try to go through where to find gaps in research so you can think of ideas for your own research topic. So before we delve into more content, I think it's really important that we go through the overall context of research climate. Research plays a critical role in driving advancements and improving patient outcomes in healthcare because it ultimately serves as the foundation for evidence-based practice, ensuring all medical decisions are based on solid scientific evidence. So through research, new treatments, interventions, and diagnostic methods are developed, eventually leading to a better healthcare outcome. And through rigorous research, we validate and refine our practices. And to understand the current climate for medical research, it's important to appreciate its historical context. We have shifted from observational study to the development of clinical trial, which introduce systematic approaches to evaluating safety and efficacy for treatments or intervention. Additionally, now we have ethical guidelines in place to make sure our participants are protected and ensure their rights and welfare are respected. So all these guidelines are set the standards for ethical conduct in research and ensure the integrity of research process. So besides all this importance of doing medical research, I also want to highlight the importance of publication for you and your medical career. So publication promote academic growth, obviously, and it expands your professional network as well as advancing your career. Residents with publication are 2 times more likely to match into competitive specialties because it clearly indicates your dedication to the field of your interest. And by publishing your work, you share valuable knowledge and positively impact patient care. So according to this JAMA study, applicants with research experience were more likely to match into competitive specialty, as high as close to 65%, compared to around 45% for those without research experience. So as much as we want to highlight the benefit of doing medical research, we do acknowledge that there are difficulties faced by junior researchers. First of all, we might not be able to identify research opportunities because of limited exposure to ongoing projects and a lack of networking at the start of your journey. And it's actually difficult nowadays to find mentors who are willing to invest their time and effort in you. Other than that, obtaining funding is another significant hurdle. Opportunities are usually competitive and require a strong track record, which we do not have yet. Other than that, when you try to seek ethical approval, we always will find difficulties when we're dealing with governing body, and eventually result in difficulty in getting IRBs. Okay, and moving on, I just want to bring your attention to what are the type of research. So mainly we categorize them into 2 big categories, lab-based research and clinical research. While they both contribute to advancing our understanding of diseases and medical treatments, they differ in their methods, objectives, and application. So let's start with lab-based research, also known as basic science or bench research. So it usually takes place in a controlled laboratory settings where we study the biological processes, mechanism, and interactions. Experiments conducted usually involve using cells, tissue, or animal models to gain fundamental insights into how our body functions. The primary goal is to uncover underlying mechanism, identify novel molecules or pathway, and expand our knowledge across various scientific disciplines. However, there are many shortfalls in embarking in such research. It can be quite difficult to find a funded position in a lab without a prior PhD. Additionally, the time to completion can often drag on many years, and reviewers are generally slower compared to clinical researchers. Especially for a clinical doctor, it can be quite difficult to understand the context of doing molecular work, which increases the inertia to completion. So unlike lab-based research, clinical research focuses on studying human subjects directly in real-world settings, such as hospital, clinicals, or community settings. The aim is usually to investigate the causes, prevention, diagnosis, treatment, and management of diseases in human population. Clinical research takes various forms, including observational studies, clinical trials, epidemiological studies, and outcome research. So the primary focus here is to translate scientific discoveries from lab-based research into practical application to improve our patient care. The studies are often clinically relevant, making it significantly easier to understand. So for the purpose of this video course, we'll be focusing only on clinical-based research. So moving on to our next segment, which is study design. So we'll be looking at different types of study designs available. So first of all, you can see which is the pyramid of level of evidence. From head to toe, we'll be going through all of them. And the higher you are, the more reliable is the evidence, which is the gist of it. So first of all, we can see at the top is systematic review, which essentially means that, when you're doing a systematic review, you aim to summarize and critically evaluate existing research on a specific topic. So they involve a comprehensive search and selection process to identify relevant studies, followed by a systematic synthesis of these findings. And sometimes it will come with a meta-analysis, which just means that you're using statistical method to combine data from multiple studies to provide a quantitative summary of the results. So next we can see there is evidence synthesis and guideline and article synthesis. So we will not go through them in detail because they are not usually commonly done by junior researcher. Moving on, we'll be looking at randomized control trial. So they are considered the gold standard for evaluating the effectiveness of interventions. Participants are usually randomly assigned to either experimental group or control group. So this study allows for comparison between groups and help establish causality. Next, we have cohort study. So cohort study follow a group of individuals over time and assess their exposures to certain factors to determine if they are associated with specific outcome. They are usually categorized based on their exposure status, for example, exposed to a risk factor or not, and follow up to evaluate the development of outcomes of interest. So cohort study can either be prospective, so following the participant from the present into the future, or retrospective by looking back at the historical data. Often a time element will be involved. Next, we have case control studies. So case control studies are retrospective studies that compare individuals with a particular outcome or interest or disease to those without the outcome or diseases. So researchers then examine past exposure or risk factors to determine their association with the outcome of interest. Moving on, we have cross-sectional study. Cross-sectional study just means a snapshot surveys conducted at a specific point in time. They assess the prevalence of exposures and outcomes simultaneously within a population. So they essentially provide a snapshot of the association between variables at a given time, but do not establish causality. Finally, we have case series and case report. Case series and case report describe the clinical characteristics, interventions, and outcome of a small group or individual cases. They provide valuable information for rare or unusual conditions and can help generate hypotheses for further research. So lastly, what you can see on the slide is background information or what we call expert opinion. So again, we won't go into detail as they are not commonly done by junior researchers. So since we have gone through the type of study design available, let's try to go through some of my previous work and try to identify their study design. You can scan the QR code on the slide to get the full text article. So first of all, we have global prevalence of non-alcoholic fatty liver disease and non-alcoholic steatohepatitis in the overweight and obese population. So just pause the video and have a think about it, and we'll be talking about the answer in a bit. Okay, so I assume everyone has already done so. So as you can see, part of the title contains the text of systematic review and meta-analysis. So obviously this is a systematic review and meta-analysis, which is looking at the prevalence of non-alcoholic fatty liver disease and non-alcoholic steatohepatitis in the overweight and obese population. You can find this article in Lancet Gastro, and obviously this is quite a huge paper, which includes more than 100 studies. So feel free to have a read when you're free. So moving on to our next article. So unlike the first one, which was an easy one, this will be slightly more challenging. So just remember to scan the QR code and try to have a read at the full text. So we're going through this article named Examining the Interim Proposal for Name Change to Steatotic Liver Disease in the US Population. So again, have a read, pause the video, and have a think about it, and we'll be talking about the answer in a bit. Okay, I assume everyone has already done so. So I'm just going to be reviewing the answer right now. So this is actually a cohort study, which we conducted using a population dataset from the US. So we categorize them into different types of liver diseases, and we compare their outcomes. Okay, so I hope everyone got the answer before we move on to the next one. Alright, so our next article, Safety and Tolerability of Obticolic Acid in Chronic Liver Disease, a pool analysis of 1,878 individuals. So just like the previous few, scan the QR code, have a read, pause the video, feel free to pause the video, and we'll be talking about the answer in a bit. Okay, so I'm just going to review the answer right now. So this is actually a systematic review and meta-analysis. So you might be quite surprised because you can't see systematic review and meta-analysis in the title, but it is not always included in the title, even if it's a systematic review and meta-analysis, which you have to pay attention to how we conducted the studies. So we try to identify this medication obticolic acid and how safe and how useful is it in chronic liver disease patient. And we managed to find 8 studies, and which contains 1,878 patients, and we analyzed their outcome. Okay. So last one, we'll just be looking at this article titled The Spectrum and Impact of Metabolic Dysfunction in MAFLD, a longitudinal cohort analysis of 32,683 overweight and obese individuals. So again, just like the previous 3, scan the QR code, have a read, and pause the video, and we'll just be talking about the answer in a bit. Okay, so now we'll just be talking about the answer. So this is actually a cohort study. So again, we use the Nahin dataset and categorize them into different type of liver disease, and we compare the outcomes. So feel free to have a read of this article. It's quite an interesting one. And before we move on to the next section, I hope everyone is happy so far with what we have gone through, and I hope this really helps you to identify different type of study design in the future. When you see an article, you'll be able to put them in the right group. Okay. So next section, we'll be looking at critical appraisal. So what does that mean? It actually just means how to systematically and objectively evaluate research studies or published articles to determine if they are valid, reliable, and relevant. So the process involves assessing the strength, weakness, and overall quality of the evidence presented in the study. So the process involves carefully examining various aspects, including research design, methodology, statistical analysis, results, and interpretation. So eventually, we want to assess if the study's findings are reliable and to what degree we can trust them to inform clinical decisions making or contribute to the existing body of knowledge. So interestingly, according to an article published on the Journal of Proceedings of the National Academy of Science in 2018, it was found that a significant number of retraction were not due to error but rather to misconduct. So from the 2000 retracted articles, only slightly more than 20% were attributed to error, while as high as close to 70% were linked to misconduct, including fraud or suspected fraud, duplicated publication, and plagiarism. So fraud might play a bigger role in the retraction of scientific article than previously thought. So it is very important for us to learn how to assess how reliable is article, so we know if we can trust the result and if we want to apply those results in our patient. So what we'll be looking at is how to assess, like what we mentioned, study design. And we'll also be looking at things like sample size calculation, how they recruit their patient, how they collect their data, how they measure their result. Moreover, how they analyze the result and how they interpret the result. We'll also be looking at things like potential sources of bias and co-founding. So why we have to scrutinize this aspect is to determine the strength of the evidence presented in the study. Eventually, we just want to make this result so that it can help us in decision making and ensure that the healthcare intervention and practices are based on robust and trustworthy evidence. So before we move on further, there are just some guidelines that are available to critically appraise article. So for your own information, you can see on the slide, there are a few of them like CASP, JBI, CBM, and many more. So feel free to have a look at on your free time, just so that you have an idea of how to critically appraise studies, and those guidelines will offer really good advice and guidance. So the best way to learn is always by practicing. So let's try to critically appraise a few articles. So first of all, let's look at this article titled Effect of Antiplatelet Therapy After Stroke Due to Intracerebral Hemorrhage, Restart, a randomized open label trial. So as you can see on the slide, there are a few things that we look at. And what I want everyone to do now is just, again, scan the QR code, get the full text, and try to go through the question one by one. So like usual, we will be talking about it in a bit, and we will see how reliable is this study and how we can apply this in clinical practice. Okay, so feel free to pause the video right now before I move further into the discussion. Okay, so I assume everyone has already done so. So before moving on further, I will go through the question one by one. Okay, so was the research question clearly defined? Was the study design appropriate? Were the participants well defined? Was the randomization process appropriate? Were the outcome measures clearly defined? Were the groups similar at baseline? Was the follow-up period sufficient? Was the statistical analysis appropriate? And lastly, were the limitations of the study acknowledged and discussed? Okay, so let's go through this question one by one. So question number one. So I believe if you have read the full text, the research question of the restart trial was clearly defined. Does starting or restarting antiplatelet therapy like aspirin reduce the risk of recurrent stroke or other major vascular events, also known as MACE, in patients who had previously experienced an intracerebral hemorrhage? So I believe it's quite clearly defined. Question number two, was the study design appropriate? So restart trial utilized a RCT design, randomized control trial. So it is actually the gold standard and it is suitable for evaluating the effectiveness of interventions. So therefore, address the research question. Next, were the participants well defined? So they included participants who had experienced a non-traumatic intracerebral hemorrhage and had a history of taking antiplatelet therapy before the event. So the eligibility criteria were clearly described, contribute to a well-defined study population. Next, was the randomized process appropriate? So it was adequately described actually in the full text. So the participants were randomly assigned to receive either antiplatelet therapy or no antiplatelet therapy as control group, using a computer-generated randomization sequence. Moving on, were the outcome measure clearly defined and valid? So the primary outcome measure was the occurrence of symptomatic recurrent intracerebral hemorrhage or ischemic stroke. Moreover, restart trial actually used validated criteria to identify and assess this outcome. So that tells us a lot about the validity of the measure. And moving on, were the groups similar at baselines in terms of important prognostic factor? So Restart trial actually reported baseline characteristic of the intervention and control groups. So that indicates comparability in terms of key factors such as age, sex, pre-stroke modified ranking scale score, and previous antiplatelet use. So this has contributed to an enhanced reliability of the study result. Moving on, was the follow-up period sufficient? So this trial actually employed a follow-up period of 2 years. So I believe that is very important for the assessment of important outcome of interest in this study. Okay. And moving on, second last question, were the statistical analysis appropriate? So Restart trial use appropriate statistical analysis to compare outcome between the intervention and control group. The methods of analysis, including the use of hazard ratios and confidence interval, were clearly described. So that ensure the transparency and replicability. And finally, coming to the last question, were the limitations of the study acknowledged and discussed? So the trial authors actually acknowledged several limitations, such as the potential for selection bias, lack of blinding, and the possibility of unmeasured co-founders. So these limitations were appropriately discussed in the study's interpretation and implications. So overall, this is a well-designed study, and this really shows a good example of a well-designed study. And I hope you have read the full text so you can get an idea. Okay. So moving on, the next article we have is the Mediterranean diet and health outcome in the SUN SUN cohort. So unlike a randomized control trial, this is more of like a cohort study. So again, we'll be going through them using the following questions or criteria. So make sure you have scanned the QR code, get the full text, have a read about it, and try to go through the questions yourself. So we'll be going into the discussion in a few seconds. So make sure you pause the video. Okay? So now let's look at the first question. Was the research question clearly defined? Even the title suggests Mediterranean diet and health outcome in the SUN cohort. So basically they are asking the question, what is the association between adherence of the Mediterranean diet and how can it impact the health outcome in this patient cohort? So I believe it's clearly defined. Second, was the study design appropriate to address the research question? So they actually use a prospective cohort design. So it's suitable for examining association between exposures and health outcome over time. So we can see, in this case, we can say the design is appropriate. Were the participant well defined and representative of the target population? So this study included participants from the SUN cohort, which consists of university graduates and other highly educated individuals. While this population might limit the generalizability to the wider population, I would still say the population were well defined and represented a specific segment of the population. Next, were the exposure and outcome measure clearly defined and valid? So this study actually used validated food frequency questionnaire to assess adherence to the Mediterranean diet. So this questionnaire have been widely used and validated in previous research actually. Health outcome were assessed through follow-up questionnaires and medical records, ensuring a valid and objective measurement. Okay. Moving on, was the follow-up period sufficient to capture relevant outcome? So this study had a really long-term follow-up period, allowing for the assessment of various health outcomes over time. So the duration of follow-up should always be appropriate to capture the occurrence of the outcome of interest. Moving on, were potential co-founding factors considered and addressed in the analysis? So this study actually adjusted for potential co-founding factors such as age, sex, smoking status, physical activity, and other dietary factors in the analysis. Adjusting for co-founders help isolate the specific effect of adherence to the Mediterranean diet on health outcomes. So coming to the second last question, were the statistical analysis appropriate? So they use appropriate statistical analysis such as multivariable regression model to examine the association between adherence to the Mediterranean diet and health outcome. It was adequately described in the full text. And don't worry, we'll be going through statistical methods in research in our future episode. Last question, what the limitation of the study acknowledge and discuss? So, if you have read the full text, you will know the study authors have acknowledged and discussed them. So it helps to provide a balanced interpretation of the finding and allows readers to evaluate the potential impact of limitations on study result. Okay, so I hope those were helpful by going through the question together so that you have a basic idea of how to appraise article or study, both in randomized control trial and cohort study. So before we move on to the next segment, I also want everyone to look at co-founding. You might have heard it just now when we were critically appraising the studies. So what does co-founding means? So when you're doing a study, you have an exposure and an outcome of interest. And if there is a third variable to distort or influence the outcome of interest, it is known as co-founding factor. So co-founding occurs when the co-founder is associated with both the exposure and the outcome, creating a spurious association between the two. So why is it so important? It can actually introduce bias and lead to incorrect conclusions if not appropriately addressed. The presence of a co-founding factors will mask or distort the true relationship between the exposure and outcome, making it challenging to determine whether the observed association is causal or merely a result of the co-founding variable. So to minimize the impact of co-founding, there are various techniques to address co-founding, but we're not going into detail in this episode. So, we will be going through some example in the next slide. Okay, so let us look at some example of co-founding right now. So example number 1, let's say in a study you want to investigate the association between smoking and lung cancer. And when we collect the data, we fail to account for age, which increases both the risk of smoking and lung cancer. When we analyze our data without considering age as a co-founder, the observed association between smoking and lung cancer may be biased. So what do we need to do to address this co-founding is by properly adjust age in our analysis so that we can obtain a more accurate estimation of the effect of smoking on lung cancer risk. Okay? So example number 2, exercise and heart disease. So suppose we are doing a study that examines the association between regular exercise and the risk of heart disease. The researchers collect data on exercise habits and heart disease incidence among participants. But if we overlook the co-founding effect of dietary habits, which may also influence the risk of heart disease, let's say if individuals who exercise regularly also tend to have healthier diets, the observed association between exercise and reduced heart disease risk may be co-founded by the influence of diet. Okay, so to address this issue, whoever is collecting the data will also need to collect and analyze data on dietary habits as well, so that we can adjust our result for dietary factors. Okay, and our last example, education and health outcome. So let's imagine a study trying to investigate the relationship between educational level and health outcome, such as the incidence of chronic diseases. So when we are collecting the data, if we fail to account for socio-economic status as a potential co-founder, what do I mean by socio-economic status? Things like income, occupation, and access to healthcare, which can affect both educational level and health outcome. So without considering socio-economic status as a co-founder, the observed association between educational level and health outcome may be biased. So proper adjustment for this factor in the analysis is necessary to understand the independent effect of education on health outcomes. Alright, so moving on to our next segment, which is basic guide for searching study. So we'll be using PubMed as an example. And don't worry, we'll go through this in really detail when we reach the episode for systematic review and meta-analysis. It's just a very important part of those studies. So, but today we'll just be going through the basic principle and going through some basic terms so that you have a better understanding. So in general, there are few principles that you have to understand. on how to search for study. So first of all, you will have to construct your search query using Boolean operators, which we will cover in the next slide. Second, you also have to define your research question really clearly. Third, you have to make sure you have access to PubMed. And next, you have to also identify keywords and search terms that you want to use that is relevant to your question. And moving on, actually conducting the search itself and knowing how to refine your search result based on the articles that you have found. And next, to screen and select articles to eventually to be used, no matter if you're doing a review study or if you're just doing, a literature review of whatever topic that you're studying. Okay, so as you can see on this slide is as showing a few Boolean operators, and, or, and not. So basically you usually use them in your search term. So and, so it will be looking at the intersected result between two keywords, or it will include both whatever these two keywords covered. And not is used to exclude something, for example, genetics, but not cloning. So it excludes result rather than including a certain keyword. So now I'm just showing you guys some examples of a PICO framework on how to construct a research question. I'm not going to go into detail right now because we are covering this in future episodes. But this is just merely an example. For example, as it shows on the slide, assessing the use of SGLT2 in preventing cardiovascular events in patients with type 2 diabetes. And there are 4 domains: patient, intervention, comparison, and outcome. And you put them in the right box to form the correct question for your research. So this slide is just an extension of the PICO question when you want to search for, studies. So as you can see, they are mesh terms and also keywords. So in the previous slide, we have put them in the right boxes in terms of domains. Now we want to expand them. We'll be going through this in detail, don't worry. And we're going through what is mesh term, what are keywords. So basically this will ensure, by putting this comprehensive search term, it will make sure that we get the result that we want in searching for studies. All right. Okay, so now let's look at how to get ideas and gaps of literature in the field of your interest. So you might be asking me, what is the meaning of leadership journal as a subheading? So that usually means the leading journal in your field of interest. So I'll just be using the field of hepatology as an example for this part. So as you can see, Journal of Hepatology, Lancet Gastro, and Journal of Gut. So they are usually really good journals. They are renowned journal, prestigious journal with high impact factor. So go for these journals to look for gaps in the literature in your field of interest. So let's look at Journal of Hepatology as an example. Always try to go to article in press rather than current issue, because article in press are usually accepted papers that are not yet published, and they usually contain the latest trend or latest topic which is trendy. So make sure you try to look for ideas in articles in press. Okay, so let's take a snapshot of the journals that I've mentioned. So you can see in the article in press, you can see popular topics being mentioned, things like non-invasive diagnosis of NAFLD and non-alcoholic steatohepatitis, which is really trendy in the field of hepatology, or things like how to diagnose a fatty liver in children. Moreover, things like epidemiology of NAFLD and how does it affect the outcome, or even global elimination of hepatitis B. So these are the review paper that you should look for, as they always try to discuss the gap in the current literature, and what field that are yet to be uncovered, so that you can try to construct your research ideas. And if you are discussing about a trendy topic, it is also more likely to be accepted by the journals. So other than journals, conferences are also a very good source if you would like to identify the gap. So I'm just going to use this conference as an example, the Digestive Disease Week, DDW 2023. So it's one of the leading conference in the field of gastro and hepatology. So what you can do is you can always go to their website. For example, in this case, you can go to the DDW 2023 website and look at the scientific sessions. Look at what are the talks, what are the poster presented, or what oral presentation that have been delivered by doctors from all around the world. So conferences usually discuss topics with controversy or trendy or even a novel innovations. So those are really good places to get ideas from. I would strongly encourage people to attend the conferences itself, but I understand it might not always be feasible from financially or logistically. But anyways, overall, conferences are always a good place to get ideas besides making connection and networking. So coming towards the end of the episode, but before we end this episode, I just want to go through a few practice questions to consolidate whatever we have learned. So we have prepared 3 questions, so we just go through them, and how we will do it is I will suggest everyone to pause the video and then try to have a read, and I will review the answer in a bit. So look at first question: which research study design is best suited for determining cause and effect relationships? So pause the video, have a think about it, and I will talk about it in a bit. Okay, I hope everyone is ready right now, so I'll review the answer. The answer is RCT. So randomized controlled trial, RCT, is designed to determine cause and effect relationship. So in an experimental study, participants are randomly assigned to either an intervention or control group, like I previously mentioned. So it allows the researcher to manipulate variables and establish, causal relationship between the intervention and the outcome. Okay, so now we look at practice question number 2. When critically appraising a research study, which of the following is not a key component to consider? So pause the video, have a think about it. Alright, I hope everyone is ready. So I'll be talking about the answer right now. So the answer is actually publication date. So while publication date may have some relevance in certain contexts, it's not a key component when critically appraising a research study. Instead, factors such as study design, sample size, and data analysis methods are more crucial to evaluate the quality and reliability of the research. Okay, so our last question number 3, when searching the literature for relevant studies, which of the following is an effective strategy to broaden your search and ensure comprehensive coverage? So again, pause the video, have a think about it, and we'll be discussing the answer in a short while. Okay, so this might not be covered extensively in our today's episode, but don't worry, we'll be talking about it in our future episodes. So the answer is actually D, employing multiple databases and search terms. So when you do that, it ensures comprehensive coverage. So it's very important to employ multiple databases because different databases has different index, have different journals included. So searching in multiple databases increases the chances of finding relevant studies. So when you use a variety of search terms, including synonym and related concepts, it also helps to capture a broader range of relevant studies. Alright, so this concludes our first episode of Research Primer series. So I hope today's episode was really helpful for you in embarking your research journey. So we'll be covering part 2, basic biostatistics, in our next episode. And thank you for your attention for listening. And make sure that you always try to practice whatever you have learned so that you always consolidate your knowledge. Thank you very much for your time, and thank you for watching. Hope you enjoyed the episode today, and ResearchLabX is here to help you to find the answers you need. We have a unique approach to research that emphasizes collaboration, creativity, and innovation. Our team is available to provide guidance and feedback throughout the process. If you are interested in learning more, contact us at ResearchLabX today using the link shown. Thank you.